Apply the fried chicken theory to life. Eat the meat and spit out the bones.
Welcome to Agency for Change, a podcast from KidGlov that brings you the stories of changemakers who are actively working to improve our communities. In every episode, we'll meet with people who are making a lasting impact in the places we call home.
Hey everyone, welcome back to the Agency for Change podcast. This is Lynn Weinman, President and Chief Strategist at KidGlov. So a few months ago, I attended a fabulous conference called the ROI of Why. It's put on by the Do More Good movement that's led by Jay Wilkinson. And Jay has been on this podcast a time or two. I love the content of this conference, but my favorite thing is the fantastic people that it attracts who speak on stage, who are in the audience, who are part of the hallway conversations. And this year at the conference, I met someone named Stacey Coleman, and Stacey has such a unique position. She is the Culture and Sustainability Manager at the UNMC College of Public Health. So what I love about that is she is in an organization that's focused on making sure humans stay healthy. And she is the one that's focused on leading their culture initiatives. She has some great stories to share. And on top of her regular job, she also is the very first president of the UNMC Staff Advisory Council that she helped to form, and she's going to talk a bit about that as well. Listen to the end because you are going to hear about the fried chicken theory, which is one to remember. All right, give this one a listen. Stacey, welcome to the podcast.
Thank you. Pleasure to be here. Thanks for having me.
Absolutely. You and I met at a conference, the ROI of Why conference, and you just have this magnetism about you. It was like, I need to meet her. I need to talk to her. And so I'm so excited you agreed to be on the podcast. And I just want you to start by telling us more about UNMC College of Public Health and the work that you do, because you have a very unique title.
Yes, I have a very unique title. Try not to make it a lot of words because some folks have very wordy titles and I didn't want that.
Yeah.
So my official title is Culture and Sustainability Manager within UNMC's College of Public Health. I've been doing that particular work since May of 2021.
Oh, wow.
So just a hair over 5 years.
Okay.
Wow, I didn't realize it until I said it out loud.
Yeah.
Sometimes you don't do the math until you say it out loud.
Right.
But I started working in the College of Public Health January of 2013 as a office associate to, which is UNMC's way of saying administrative assistant.
Okay.
And quite frankly, that was to pay the bills and help fund my life, which needed to be done and just kind of morphed into that. But when I applied to UNMC and saw the College of Public Health, I really liked what they were doing because prior to the pandemic, a lot of people didn't know what public health even was.
Right. We didn't even think about public health until the pandemic.
Really.
And then it's
really.
Oh, yeah, this is important.
It's very important. So what I like to call us, and this is my elevator pitch, you won't find it on the website, but when I'm in the community and people ask me, I say, we do the micro and the macro. We do the things you can't see every day, but that you trust in every day. So clean water, clean air, clean environment, healthy populations.
Yeah.
So like a doctor that's an MD that goes into a clinic and they see a patient, they see however many patients they can see in the course of a day. We'll say 10, just for the sake of math.
Yeah.
Whereas our research, number one, helps that physician make those direct clinic to patient decisions through the research, but we also affect populations.
Yeah.
So you think about, again, we'll use the one that everybody knows of. We'll use the pandemic. Yes, we were the ones telling people to wear the mask because you got to understand everything kind of hit late winter, early spring of 2020. The vaccine didn't come out until mid-winter of 2021.
Right. I mean, I've been trying to remember back because, it's funny how soon you forget. Like that was such
Mhm.
a big and fast and life-altering event. But it seems
Yes,
like lately I've been talking about it and I have started to forget. Like I have started to, forget what was it like the first day when we shut down and what were we doing and how long did it take for the vaccine to come out?
right.
It's amazing how soon we forget.
Fortunately, we in the College of Public Health, we haven't forgotten.
Right. Thank you
And
for
that's
that.
and that's what we're here to do. We're here to make it so that things, little bugs, you're hearing about I can't pronounce it, but the one that's making everybody really
Oh,
weary of going to get a
yeah.
bag of lettuce right now.
The
Um,
one, yeah, nobody wants to
yes,
eat lettuce. Everybody
yes,
everybody is giving up those salads at the moment.
yeah, everybody's like, nah, I'll pass. But, I remember our dean saying this several years ago. We're doing our jobs well if you don't see us doing our jobs.
Right.
So we literally are, I don't want to say invisible because, we're here,
Right.
we're humans. We do take up space, but you think about everything that you do, and in short, if you think about it, every single thing you do is regulated in one way, shape, form, or another. Public health is part of that work
Yeah.
to make the water as clean as possible, to make your children's going back to school experience as healthy as possible. Again, public health, everybody needs to be healthy. So think of it as populations. So, yes, we help those physicians in the clinic have conversations with their patients one-on-one, but we also help populations, we help politicians and businesses and municipalities all over the world. It's not
Yeah.
just even here in the state of Nebraska or in the United States. We are worldwide.
Yeah.
I think of that old Rob Bass song. We are internationally known
Absolutely. I
for
think
that
you're
very
one of
reason.
the things people in Nebraska have a lot of pride over UNMC, right? And the work that
Mhm.
you've done during COVID, the work that you've done through some of the other major health epidemics that, people
Mhm.
turn to UNMC, the work that you've done
Mhm.
on vaccine campaigns, not just COVID, but
Mhm.
all across the board. I think that's really cool.
Absolutely.
I want to,
Absolutely.
Stacey, I want to give a shout out too to my friend Dr. Kalila LeGrand. I don't know if you know Kalila, but she is based here in Nebraska.
Mhm.
And she is the Vice President of Communications and Public Relations at an organization called ASTHO, which is a tough acronym, but it's the Association of State and Territorial Health Officials, I believe. But
Mhm.
when she was on the podcast, she said the same thing. She said, if we are doing our job, you do not notice us. And when
Right.
people are complaining about water or viruses or different things, then that's our work happening. Yeah.
Yes. Yes. And and I liken it to what a car mechanic told me years ago when I was frustrated that I had spent $800 on a car repair.
Mm,
He said, you spent $800 so that your car, whenever you need it to go, goes. And it
yeah.
hums, that nice gentle
Yeah.
hum you hear when you go down the road instead of clicky clack clack boom 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 bam pop. He goes, you could have got the clickety click boom boom bam pop for $400, but you would be stuck on the side of the road.
Yeah.
And so that's really what public health is about. It's making sure that everything so that you can live your life and you don't have to think about, is my water clean? Is my
Yeah.
air, clean? Is, you know, all those things, the food supply, everything,
Yeah.
everything. I'm thinking about food because I'm a fluffy girl and I like to eat.
I like
Those are not the only examples, but those
yeah.
are the ones that I relate to the most because, again, food is my love language.
Well, and you think about it, we all just kind of take it for granted until something comes up like this. And I can't pronounce it either, but this thing that's going on right now that's kept us from
Mhm,
eating lettuce for a short time. So then I love that you are doing this work to make the
mhm.
world a better place. And I think since the pandemic, a lot of people have refocused and said, I want to make a difference in the world. So you are at the epicenter of that at the College of Public Health. But then on top of that, you are the culture and sustainability manager. It sounds a little bit like the dream job of purpose-driven work. Tell us more about
Wow.
that.
Well, yes. So let me be clear. I am not my degrees are not in public health.
Okay.
I'm what I call, I work in the College of Public Health. I'm public health adjacent,
Yeah,
but I'm also chief CEO, chief encouragement officer.
love that.
I love to, hype up my faculty and the staff members and the students for the wonderful, awesome work that they do. So everything we just said was about their work.
Yeah,
Now, what I do as I walk the halls of the College of Public Health is I'm there to make sure that, again, the faculty, the staff, the students, alumni, community partners, all those folks, when they come in and they interact with us, that they have a positive cultural experience, whatever
yeah,
that may be, because again, we are affecting populations. So we need to be astute and understand the needs and wants and desires of those populations, both outside of us and inside of us. How are we
gotcha.
affecting that change? Are we being our best selves, our authentic selves? Realness, all those things, belonging, inclusivity, coping, all those things that we need to be so that we can deliver the best product, and I'm putting product in air quotes,
Yeah.
as possible. So that's what I am there to do. And that's where my education and experience and all of those things kind of come back and bring it on home.
Yeah.
I like baseball too, so a baseball analogy might pop up here any moment. Go Cardinals. I'm a St. Louis Cardinals fan.
Okay, well, and if you're based in Omaha, you should know a thing or two about baseball as well.
Just a
Being
little bit.
right, you should,
Just a
you
little bit.
should. So Stacey, I want to follow up on that because you talked
Mhm.
about your experience in getting into this role, but what does your background look like? I'm really curious. Like I'm imagining a little 10-year-old Stacey on the playground, and somebody says, "What do you want to be when you grow up?" And you say, I want to be a culture and sustainability manager. I'm guessing it didn't exactly go like that.
No, 10-year-old Stacey didn't even have a clue what that was.
Right, right.
The best way, my journey has been a lot of squiggly lines. It has not been
Mm.
linear by any stretch of the imagination, but it has been organic.
Oh,
I think that
okay.
would be the way I would describe it. And I think of it like the nesting dolls. One
Yeah,
thing leads to another. So that's what I mean by organic.
I love that.
Somebody asked me this actually a couple of days ago. I was in a training and they were like, "How did you get into this?" And I was like, "Well, I was walking down the hall, minding my own business." And they laughed because they thought I was, making it up. And I'm like, "No, that's literally what I was doing. I was walking down the hall, minding my own business, trying to get through the business day, doing whatever business need I had to do in that moment. And
Yeah.
somebody yelled my name from down the hall and they said, 'I heard that you like to do this.'" And I'm like, "Yeah." They said, "You should be part of this meeting." And I said, "What meeting?" And they're like, "You didn't know that we were meeting?" I said, "I had no clue that that even existed."
Oh man.
Um, and they said, "You should come to the meeting." And I said, "Okay."
It sounds a
Um,
little bit like a kidnapping.
it wasn't a kidnapping. It was kind of, I mean, I did jump when they shouted my name from down the hall. So
Yeah.
it was startling, I will say that.
Okay.
And the long and short of it is I kept asking questions. People kept saying yes, and you should do it. And I said, "Really?" And they said, "Yes, you should do it." And I asked the people, I said, "Can I do this?" And they said, "Yes, you should do it." And bam, I'm doing it.
Cool.
I
I
mean,
love
that's
it.
that's the short version of it.
I love it. That's awesome. So then on top of that, though, this isn't the only thing you're doing because alongside this work, You've
Mhm.
also taken on the role of you're the inaugural president of the UNMC Staff Advisory Council. So tell me more about that. You sound like the kind of person that likes to be involved.
I blame that on my mother. My mother was, she basically said, you know what? If you don't work, you don't eat. I
Well,
like to eat,
yeah.
therefore I work. That work again happened organically. It was the summer of 2020, in the middle of the pandemic.
Mm,
Was in a meeting, and we were all kind of on Zoom, of course,
yes.
and we were all kind of brainstorming. And somebody said, our campus doesn't have a staff senate, staff advisory council. The other NU campuses, Lincoln, Kearney, Omaha, they do. How
Yeah.
come we don't? And I was like, well, let's ask. So we did a survey, roughly about 400 and 450 people from all around UNMC said this is a good idea. One of those people at the time he was Chancellor Gold, now he's President Gold.
Oh, right. That's right.
He was actually one of the respondents. We all looked at each other, our jaws dropped, our eyes got big, and it's like, did you see who responded to the survey today? Um, so we knew from the very beginning that we had administrative buy-in, which was a very good thing, but we still had to put in the work. So that
Yeah.
started that summer of convening a group of half a dozen now former, some of them are no longer with the university, but we reached out to about a half a dozen UNMC employees and said, hey, would you be willing to, again, this is the work of the gaps. Nobody's getting
Yeah.
extra pay.
Right.
You still got to do your regular job, the job that's on your job description
Yeah.
job. But we met over the course of, I don't remember how long, I want to say, because it was the work of the gaps. I want to say for at least a year, maybe two. And we hammered out UNMC Staff Advisory Council bylaws using the other campuses bylaws as templates,
Yeah.
and putting in our own verbiage and our own needs, because while we are within the NU system, we are also the medical center campus, so we're a little bit different from our sister campuses
Yeah. It
in
is a
several ways.
different thing, right? Yeah.
Right. So using those other bylaws as templates sometimes didn't work. So that's when we had to have discussions. Some of them were very active and very robust discussions, let me tell you. But we eventually got it done. We got it approved by leadership. We got it reapproved by leadership because that's not just a one and done process. And we officially became recognized when Dr. Gold. He's always Dr. Gold. I got to remember, was he chancellor or president at that time? When Dr. Gold, who then is now President Gold,
Yep.
convened us April 29 of 2025.
Wow.
And we jam-packed into a boardroom, and it's like, this is it. We're
Cool. So
here.
you've been
And
going for a little over a year now.
just a little over a year, just a little bit. As a matter of fact, my presidency will wrap up here on Friday, the end of this
Oh,
month.
wow.
I'll
Congratulations.
right, I'll move into the past president role. So I'll still be on the executive committee for
Yeah.
another year, but I passed the baton to the next president coming up. So a lot of lessons learned in this last year, a lot of
Yeah.
revisions and things like that. A lot of good work happened. And again, sometimes you just sit back and you catch your breath and you drink some water and you go, whoa,
You're doing some big
didn't realize,
things.
right, didn't realize, but it's kind of like, you look back at a project after it's done, it's like, man, and people are like, how long did it take? And you're like, you don't want to know. You just don't want to know. Just be glad it's done. Enjoy the
Yeah.
doneness of the project.
Yeah. 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 Sometimes
um,
if you knew what it was going to take, you would never get started, right? I mean,
girl,
ignorance
girl,
is bliss. Ignorance
girl.
is
I don't know
bliss.
how many times. And I remember as a young girl, and a young adult, I remember the ancestors would tell me that they were like, if you understood everything that it was going to take, you would say no.
Mm.
Like, yeah, because if you would have asked me in 2020, knowing what it was going to look like come 2025, 2026, I probably would have said no. to be honest. I would have said no. I'm
Yeah,
glad that I did not say no. And I'm
right.
glad that that's how the universe decides to do things, is don't tell you everything up front,
Yeah.
because fear factor is real.
Yeah. So I'm curious, I'd love to kind of reverse that a little bit and think about
Okay.
you've been at UNMC, is it 20 years now?
I have been within the NU system for
Ah, 20.
actually 20 years and like 7 months. I
Wow.
started at UNO beginning of January, beginning of the calendar
Okay.
year, January of 2006. I worked in the Career Center at UNO from
Mm,
January of '06 to October of 2012. So roughly about 6, 7 years.
yeah.
And then came on here at UNMC January of 2013 and have been in the College of Public Health ever since. I've been on two campuses within that 20.5 years.
Yeah.
Yeah.
Whew. It's a lot. I'm really curious how these experiences, being with the College of Public Health, being
Mhm,
the culture and sustainability manager, and now being that inaugural president of the faculty or staff advisory council,
mhm.
how have they shaped your views on leadership and what leadership means to you?
Oh, Lynn, how much time do we got? The one thing, again, I'm kind of going, remembering past Stacey. And when
Yeah.
I remember I had a director at UNO when I was at the Career Center, and we were getting ready for a large scale event. And I think I had a little, I know, not I think, I know I had a bit of imposter syndrome in that moment because I was
Yeah.
being asked to talk to these people with, big fancy titles. And here I am, just little lowly Stacey Coleman.
Oh, no.
And she sat me down and she looked me square in my eyes and she said, Stacey, titles don't mean bleep. I'll let your audience figure out
Fill
what the
in the
bleep means.
bleep. Okay.
Fill in the
And
bleep.
thank you for bleeping yourself because I don't have bleeping technology, so I appreciate that.
I watch enough late night TV to learn the value that it is best to self censor because sometimes
Yes,
they don't always catch it.
sometimes.
That is something that title and expertise are not necessarily synonymous.
Right.
That's something I've learned in this past year. You can be the expert in the room and not have the title. You can be both. You can have the title and be the expert. Yes, absolutely. Let me not ruffle any feathers here.
Right. Right.
But I realized how many times experts are called in, much like when, I like to watch some of the legal shows, much when the defense or the prosecution will bring in an expert,
Yeah. The
um,
expert witness,
the
right?
expert
Yeah.
witness, the person that knows, a lot about this very specific thing. And I was amazed at how many times that happens.
Mm,
But because the thing that I also learned is leadership don't necessarily like to make fly by the seat of their pants decisions. They know
especially
sometimes they will.
not in higher education, I think.
Bingo,
Yeah.
bingo. But you got to do what you got to do with what you have in that moment. And that's where understanding how to discern what should versus should not be done, regardless of what your constituencies are or are not saying, and things of that nature. And it's not easy.
Yeah.
My mom always used to say, there's a cost to be the boss.
Mm,
And, some titles I'm okay not having.
yeah.
That's also what I learned in this last year. Some titles I'm okay not having. And
Yeah.
I'm not, and I look at the people that do have those titles with a different level of respect, because there are days it's 6, 7 o'clock in the evening and I'm enjoying my evening eating dinner. Not always, because
Yeah, but
sometimes it required late hours for me as well, but more likely than not. And I was remembering how someone once told me one of the leaders, their average getting home time was 10 o'clock at night.
yeah, right.
I'm like, no.
It's not as glamorous as one might think, right?
Not nearly, not nearly,
Yeah.
not nearly. And that's the big revelation. And but really and truly, kind of going back to the ROIY conference where we met,
Yeah. It was a
the
great
biggest,
conference, by the
it
way.
was a tremendously awesome conference. Learned so much, and it validated so much.
Yes.
So it wasn't
Yes.
just learning, but confirming
Yep.
as well.
Which is really important. Yes.
Yes. And the biggest thing that I think people forget, especially in these unprecedented times, one of my leaders and mentors told me that, and I told him I was going to steal it. We all need to remember we're human too. Leaders are just
Mm,
as human as we are. They put their pants on one leg at a time, just like we do, Lynn. As a matter of
amen.
fact, one of the leaders that I truly respect very highly, I saw her at Costco.
Yeah.
And I'm standing there having like this really weird, because it's Costco, it's a
It's
weekend of the
Costco.
weekend.
Yeah.
There's like 50 people in between me and this person, but I see them from afar. And I realized I was having one of those moments like when you're a little kid and you see your teacher outside of school and you don't realize your teacher is like
Yeah.
a real person.
Yeah.
And I was like, she's shopping at Costco just like me.
She's got
And
to
it's
do
like,
chores on the weekend just
right,
like you do,
like
Stacey.
yes, like she needs groceries just like she eats. Like, those things that you sometimes really truly, even
Yeah.
as a grown adult, you forget that
Yeah.
these people are just as human as you are. And in some
Yeah.
cases more so.
Mm,
And life's for them just as much as it does for you. They've had love and loss and days where their body is fussing at them, and they show up and
yeah.
they show up and they don't complain, and I'm not going to say they never complain, but they don't complain, and they still get the job done.
Yeah.
And that to me was one of the biggest lessons, was recognizing the humanity
Mm,
of the leaders.
mm. I love that. I'd love to take that even to the next
Hmm.
step. And I imagine you've got some deep thoughts on this, but as you think about being in a role where you shape workplace culture,
Hmm.
what are you finding is most important in creating that culture where people can really thrive and thrive as human beings and not robots that clock in and clock out and do everything exactly right?
Well, I'm going to go ahead and put it on repeat, and I'm going to say the same thing. It's recognizing the humanity.
Mm,
We are not robots. We're not AI. We
yeah,
use AI as a tool, but we are not AI.
we are not AI. Yeah.
And we are not monoliths. We're not just one. I had my former pastor. She's a diamond aficionado. She loves herself some diamonds.
Mm,
And she held up this very large acrylic diamond. And she said, to a perfect diamond, there are 57 facets.
mm.
I use this example a lot.
I did not know that.
I didn't know it either. But, again, sometimes you just sit there and you learn. She also taught like her congregation like a college professor. So I was ready to get my master's degree before I ever walked into a graduate
Well,
class.
spirituality would be a good thing to get your master's degree in, or humanity.
It's an awesome thing. And so that's what she said. She goes, there's 57 facets to a perfect diamond. She goes, but can you, from where you're sitting, can you see all 57 facets of this diamond? It's like, no. It's like, you might be able to see 10 or 5, or somebody, because we had a sound booth that's kind of set elevated and high up. She goes, you might be able to see 20. But until you get up close and you spend time
Mm,
and you have the right instruments to look at that diamond holistically, you will never see all 57. And so I say that to say, when we are in our workplaces, even though I show up authentically, you may only see 8 facets.
yeah,
You may
really
only
good
see
point.
12, because I don't need to bring every single facet of me to work that way today.
Yeah.
But that doesn't mean that I don't have those facets. And so when I think of what my specific role and what my specific work is to help other people see that and to acknowledge that. And one of the things I've been saying of late is this is not just the time to receive grace, this is also the time to give grace.
Mm.
And not just to each other, but also to
To
ourselves.
yourself, for sure. Put your
Um,
oxygen mask on first. Easier
exactly.
said than done, right? Like it's so easy to tell
Yes,
everyone else to do that. And then when it comes to yourself or myself, yeah.
yes. And it takes practice. And that's why when I interact with people and they look at me with those big, huge eyes, and I said, you're gonna more likely the first few times mess it up. Like I'm gonna give you, I need you to inhale, exhale, bring the shoulders down, breathe. Be surprised how many people aren't breathing in that moment. Like
Yeah, right.
I'm like, you were holding your breath that whole time, but be okay. And that's the other thing. Be okay sometimes, like knowing you're gonna mess it up.
Yeah.
Because again, we are human. And we're not on purpose walking. Like, I'm not going to wake up tomorrow going, you know what, today I'm going to mess something up. No, I'm going to go in doing the best I possibly can. But that is also a gradient of success. Some days the best is 75%. Some days it's 20%. Some days it's like, look, just be glad I opened my eyes, my feet hit the floor,
Yeah.
those
Yeah.
things. So, and then everything else can be added on and can be learned and can be taught. But once you really recognize and remember to consistently see yourself with grace and see others' humanity with grace, it makes the work that I need to do a whole lot easier.
I love it, Stacey. It's really great advice. And also, while you were saying breathe and drop your shoulders, it was a good reminder to me to breathe and drop my shoulders just while we're
Exactly.
talking here today, right? It's a good reminder.
Exactly.
So, Stacey, as you're thinking about UNMC, I mean, I
Hmm.
know you're soon to be the past president of the Advisory Council, but what else
Hmm.
is on the horizon? What are you excited about that's coming up?
That's a very good question. I've actually been thinking about that. Right now I think I'm just in a transition phase, and that's
Yeah,
okay.
yeah,
I've actually been thinking about that for several months now. It's like, okay, there's going to come a day where you're not doing this. So what are you going to do? And I get a lot of revelations when I'm cleaning my townhouse,
mm,
when I'm vacuuming or mopping or just cleaning, because that's tactile. Like sometimes I just need to, that's how
yeah.
I get the anxiety out. It's like, you know what? Let's go do a load of laundry. Sometimes there's only 3 pieces of laundry in the load. Don't care.
We're
It's
just gonna
just
do it.
about, yeah, it's
Yeah.
just about going somewhere and like re, reprogramming the brain. And I said to myself, you know what? It's okay not to have all the answers right now. Because I thought about my journey, like the question you just asked me previously about how did you get from 10-year-old self to,
Yeah, to hear.
where you are
Yeah.
today. And like I said, it really truly did happen organically. And I just said to myself, you know what? I'm just going to continue to lean into that. I'm going to lean into, and that sounds like I'm just letting whatever happen happen. No, that's not what it means. It means I'm not going to try to overdo.
Yeah.
Like, okay, I'm going to wake up. And sometimes it's like, all right, let's just focus on what needs to be done today.
Mm-hmm.
Not even
Yeah.
trying to get to the end of the week. I'm just what needs to be done today before the sun goes down, before you close the laptop, before you get in the car, drive home, what needs to be done today.
Yeah.
And that's it. And there's a saying above my desk in the office that I got from a coworker shortly after my mom passed and I had come back to work, and whoo, that was hard to do.
I can't
And
imagine.
it's a cup of tea sitting on a windowsill with the rain. The rain is on the raindrops are on the window. And it just says, you don't have to take everything today all at once. Just take it
Mm,
one day at a time. Things will get done when they get done.
mm-hmm.
And that's what I think about. I think about, I don't need to try to sit there and spin my wheels and think about 50 million things today.
Mm-hmm.
They'll get done when they get done.
Yeah.
Or it's like the spiritual people would say, everything has a season, everything in its due time.
Yeah.
And you don't
Stacey,
want to rush it.
I appreciate that because I also believe being somebody who has I've had chapters in my life where I've
Mm-hmm.
tried to control and drive and plan everything, right?
Mm-hmm.
And what I find is when I try to have that level of control and I go through life literally with my fist balled
Mm-hmm.
up and my jaws clenched,
Mm-hmm.
I'm not present to see the opportunities that are around me. And I think that
Exactly.
being open to see what's happening and accept those opportunities, being open to letting people help you, being open to, riding the wave as opposed to swimming against the current. I think
Mm-hmm.
those are lessons that I learned later in life, and it's just funny because what I thought was going to lead to success is not exactly the way it worked out, right?
Exactly. And that's life. And that's what I tell the young people that I mentor, because, some of them are, gritting their teeth and they're grinding their teeth. They're not even gritting, they're
Yes,
grinding.
they're
They're
grinding.
grinding
You got it.
and they're like, I gotta do and I gotta do. And I just ask a very simple question. I said, who said? And
Mm.
they look at me like, what? I said, who said that that's who said? Who said that you're gonna fail if you don't
Yeah.
fill in the blank or whatever they told me they needed to do? And they're like, nobody. Nobody said it. I
Mm.
said, so if nobody said it, who you listening to?
Yeah.
And then they just look at me like, what, but what? Be still a second, take a beat. That's one of my favorite phrases,
Take a beat.
especially
I
with
like it.
one
Take
of
a
the young
beat.
men I mentor is like, take a beat.
Mm-hmm.
And he will. He's learned. He's like, okay, when Miss Stacy says take a beat, I really need to take a beat. I'm like, take a beat and ask yourself some questions. And I'm 53 years old, soon to be 54 here, closer to 54 than 53. And I have to ask myself those same questions sometimes. It's like,
Yeah.
okay, remember to take the breath in, drop the shoulders, ask yourself some clarifying questions, then proceed.
Yeah.
Um, yeah, it's really about just, for me right now, in relation to that question you asked, is, just trusting the process, will be the process, because it
Yeah.
has been, again, my experience has been, you've done that before and everything's been just fine. So why do you think it wouldn't be just fine moving forward?
Mm. I love it.
There
I
you
love
go.
it. Stacey, one of the reasons I was really excited to have you on the podcast is I know we have a lot of leaders that listen to this podcast who are really concerned about taking care of their people and having a good workplace culture. And sometimes it's not always easy. I'm really
Mhm.
curious. Do you have some advice for us on what are some key things leaders can do to help instill that culture that's really, healthy and helps people thrive?
I didn't know that this was an actual term. So I'm going to tell it to you the way I learned it. Then I think
Okay.
I'm going to try to use a fancy word that I learned just this past
Ooh,
week.
all right.
But I get that question. I've heard that question on more than one occasion. And again, in my experience, you know, the best leaders that made the culture positive, one of the things that they did is they took a walk.
Take a walk.
They took a walk. They number one, they would take a walk to clear their own minds. So there are two types of walk: the walk by yourself and the walk with others.
Mm,
So sometimes they were just walking, like, got to get it out. Again, that tactile thing of, like they say, touch grass, go out, breathe some non, air conditioned air. I know today's
yeah.
not the day to do that, but
Not
you know what I'm
today.
yeah,
It's
not
it's
today. Like,
102
okay,
outside right
yeah,
now.
like
Yeah.
It's disrespectfully hot out there right now. So uh, please do yourself a favor and stay in the air conditioning. But um, take a walk and just be with yourself. And ask, and like how just do that inventory of you, like how are you today? How are you feeling? Are you angry? Are you sad? Are you don't even know yet? You just know you're something and you don't like it. Take a walk.
Mm.
And then the other take a walk is, again, former pastor, what she would do at the end of every service is she would go to the back door and stand by it and basically greet you as you left the church.
Yeah.
There weren't long conversations, but it was just, how are you doing? And sometimes people were doing okay, and sometimes people were not doing okay. And the times when people weren't doing okay, it's like, you know what? Let's get some time together where you and I can meet and discuss and get from not okay to okay.
Mm-hmm.
Sometimes there were progress reports, like things weren't okay the last time I talked to you like this. Now they are. But it was a time to create an environment where everybody was able, for one way, for from the youngest to the oldest,
Yeah.
literally would see her bend down and talk to little kids, like the little 2-year old,
Mm.
got the binky in their mouth and the diaper and holding their stuffy. But if they wanted to say hi, she would listen and let them, help them. I remember because they would say yeah a lot, and she would say
Mm.
yes, and when they got to 3 and 4 years old, they were saying yes. But again, just taking that time to meet people where they were at.
Mm-hmm.
That's what I mean when I take a walk. I have a I have a leader present day. He'll just roam the halls and you'll
Yeah.
hear him.
Mm-hmm.
Um, and you'll hear him not in a bad way. It's not like, oh shoot, he's coming, look busy. No, it's okay, I know what he's doing. He's taking a walk. He's just, I call it a little constitutional. And
Mm-hmm.
he's just stretching his legs and he's checking and hey, and if you catch him, it's like, hey, can I talk to you for a sec? And again, you might get a couple of minutes, but again, even those little bitty minutes, just 2, 3 minutes,
Yeah.
that's the tone for the rest of your day. That's the tone for the rest of your week. Could even be the rest of your month.
Mm.
Because it's like, man, I was stuck on this. I'm on this project. I'm stuck on this. And he's like, do this, 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 and this. And I'm like, okay, cool. Give them a little
Yeah.
bit more backstory because again, I learned I want to give as much information to the leader as possible to make the best decision as possible. So this is not the time to hold back.
Mm.
But that would be the biggest recommendation is you got to get out and you got to take a walk.
Mm-hmm.
In Lean Six Sigma, they call it the gimbal walk.
The gimbal walk. I'll have to look this one up.
G like girl, EMBL.
I'm
I
glad you
learned that
spelled
from
that because I wouldn't have even been able to find it in search because I was spelling that so wrong.
oh no,
GEMBL. Okay, the gimbal
yes.
walk.
hmm
All
And it's
right.
really recommended that that's what leaders do. It's take a walk, and you're basically kind of gauging the temperature of your organization, industry, whatever the case may be, and you learn in those things because I've also heard that same leader say, I took a walk and I had a conversation with fill in the blank, and again was something that was really weighing down on that person's mind, but being able to have that conversation and just talk it out was able to really iron out a whole lot of wrinkles that made our process run so much smoother.
Yeah.
And again, but and you think, well, what would have happened if
Mm-hmm.
the leader hadn't have taken the walk and hadn't have had that 3 to 5 minute conversation with so and so? What would have been missed? What
Mm.
would have been dropped? So while some people may see that, again, looking at that facet again, some people may see that as wasting time. When you think about what you're trying to do in the course of a day and the intentionality behind the walk, you're not just walking the walk. You're walking to inform, to be informed,
Mm-hmm.
to allay fears and concerns. Because sometimes, again, even as adults, we operate out of anxiety. That ain't a good
Absolutely.
thing.
Absolutely.
And leaders can basically just tell somebody, you know what? Just like a parent, when a little kid is afraid of thunder and lightning, you know what? It's going to be okay.
Mm.
And then not only do you learn that it's going to be okay with the thunder and lightning, you grow to appreciate the thunder and lightning.
Yeah.
Because
I
you
like
know
that.
that it's because you know that, okay, thunder and lightning, it's going to be rain, and then everything's going to be good and green, and the flowers are going to be all nice and pretty and smell really nice and sweet in the morning.
Yeah.
And so, you know, you learn how not to be afraid. You actually learn to lean into it instead of lean away from it.
I like the way you explain that, Stacey. It really kind of helps me get into it, and I appreciate it because take a walk is kind of a catchphrase that we all can remember. So I
Mhm.
like that a lot. So
Mhm.
Stacey, let's say for people that are listening who you've maybe piqued their interest about public health and the work that they're doing, how can they find out more about the UNMC College of Public Health?
We have a website.
Okay, all right. This is always my invitation for people to give me their websites. And we
Yeah.
will
Or
have your website in the show notes on KidGlov's website as well. But give us your website address.
yeah. So it's, well, I always go to, and I apologize, it's unmc.edu, and you go to colleges and institutes, and you just click on College of Public Health.
I love it.
Bang, boom, you know.
That's the easy way to do it, I think.
Yeah, you have 2, 3 clicks and you're there. And you can do it on your phone, you can do it on a computer, do it on your tablet.
That's
You can
great.
also come to campus and talk to us. We're here.
Okay.
Yeah, just we're also on LinkedIn, Facebook, Instagram. You know, again, just put in UNMC College of Public Health. We'll pop up. You can find out about all the good things we're doing both on campus and outside of campus, both in Omaha and all throughout the world.
Wonderful. Well, I
Mhm.
will get all of those links on the show notes for this episode as well, Stacey,
Awesome.
because I want to ask you my favorite question next. I've asked it on every episode of the
Dun, dun,
podcast.
dun, dun.
Here we go. It's the big one.
All
Stacey
right.
Coleman, I am inspired by motivational quotes, and I want a Stacey Coleman original quote to inspire our listeners.
Okay. Are you ready?
I'm
I've
ready.
thought about this for several days now.
All right.
Apply the fried chicken theory to life.
Okay,
Eat
I
the
love
meat
it.
and spit out the bones.
Eat the meat and spit out the bones.
Yes.
I have heard a lot of quotes in the course of doing this podcast, but I have never heard one like that. I love it.
Yes.
Apply the fried chicken, what'd you call it? Principle?
Fried chicken theory.
Theory.
You eat the meat and spit out the
Get
bones.
out the bones. I love it. That is so good. Stacey, I have so loved this conversation with you. And as we wrap up today, I'd love
Mhm.
to hear what is the most important thing you would like our listeners to remember about the work that you're doing.
This work is 100% necessary work.
Mm, yeah.
Doesn't matter who you are, what you believe, we all need to be healthy.
Mm,
And we all need others to be healthy. If COVID-19 pandemic taught us nothing, is that we all need each other.
yeah.
Even the hermits amongst us need each other.
Yeah.
And we need each other to be healthy. And that's not just physically, because public health is not just physical health, it's
Hmm.
physical, all of it. So yeah,
Okay.
that's the biggest thing. Ain't
I love
nobody
it.
getting through this life by themselves.
I love it. Stacey, on that note, I'm going to say I fully believe the world needs more people like you, more
Shucks.
organizations like UNMC College of Public Health. And I just really appreciate you taking time from your busy, busy schedule to talk with us today.
Well, thank you for taking time out of your busy, busy schedule to talk with me today. And I hope that this helped you. I hope this helped your listeners. And if anybody has any questions for me, feel free to reach out anytime.
Sounds great, Stacey. Thanks so much.
Thank you.
We hope you enjoyed today's Agency for Change podcast. To hear all our interviews with those who are making a positive change in our communities, or to nominate a changemaker you'd love to hear from, visit KidGlov.com at KidGlov.com to get in touch. As always, if you like what you've heard today, be sure to rate, review, subscribe, and share. Thanks for listening, and we'll see you next time.